Thibitarĩ-inĩ mũnene wa Kapsabet kauntĩ-inĩ ya Nandi nĩkuo rũhonge rwa ũgima wa mwĩrĩ kauntĩ-inĩ ĩno rũthondekete kambĩ ĩtarĩ marĩhi ya gũthima mũingĩ kansa ya mũthiori ĩrĩa ĩrerĩkana nĩ ĩgũmĩire aikari aingĩ kauntĩ-inĩ ĩno.
We have a concern that the cases for prostate cancer, breast cancer and cervical cancer are on the high in Nandi County, and we have been talking to our patients and also to our communities to ensure that it is very important that they get early screening because all of those cancers are actually treatable.
Rũhonge rwa ũrigitani rugĩte mũbango ũyũ ũkĩte nĩguo kũhĩtana na mũrimũ wa kansa tene ũtanakũrĩrĩra mwĩrĩ-inĩ kuona nĩrĩo mũrimũ ũyũ ũhotaga kũhĩtĩka.
Most of our patients come in stage 4 or stage 3. So I think we need to first as a county emphasize on sensitization. Let's tell our people that anything abnormal they see in their bodies, they should move forward and tell the nearest health worker.
This partnership with CIC has been very beneficial for our citizens to have access to cancer care, both screening, treatment, as well as maintenance care. I would like to say that
Ndagĩtarĩ Dinesh Pithaka ũrĩa nĩ mũtaaramu wa mĩrimũ ya kansa nĩ athingatĩte honge cia ũrigitani ithomithie mũingĩ bata wa gũikara ũgĩthũrimagwo ũgima waguo wa mwĩrĩ nĩguo kũrũa na mĩrimũ ta ĩno.
The county government later on, whenever it finds convenient, will think on what measures to take to early diagnose prostate cancer, at the same time make public and people aware of prostate cancer so that they come early to the clinics and to the hospitals. Because once treated early, this is a cancer which is curable. Patient can live a long, comfortable life. So I really want everybody from this county to understand that if you have signs and symptoms of prostate cancer, please approach doctor.
Not only the delays that we usually want to blame to the patients, it's also within the healthcare system that we need to make them aware that there are so many other cancers and how these cancers present. So the biggest challenge is late diagnosis, and it cuts across all cancers.
And if our citizens cannot to come for early screening, I will repeat that cancer can be treated and our patients can be cancer free.
Ndagĩtarĩ Dinesh augĩte marĩ na mĩbango kũgĩa na kaunti ingĩ bũrũri-inĩ gũthomithia mũingĩ ciĩgiĩ mũrimũ wa kansa. Ngĩribotera Inooro TV, Getu Wangari Maria wa Mũigana.